Alright, and moving on to the last section of hemolytic alterations, and then we will move on to cardiac. Yay. Okay, so we have the leukemias. Now, the leukemias is a group of neoplastic disorders involving the white blood cells. Leukemia, leuko, white blood cells. This is where you have uncontrolled white blood cell production. One or more types of the leukocytes are going to be undifferentiated, immature, and they're not going to be functioning. And then large numbers of these immature, non-functioning, undifferentiated leukocytes are going to be released into the general circulation, and they're going to infiltrate the lymph nodes, the spleen, the liver, the brain, and other organs. It's not good. Just a little side note, a predisposing factor to leukemia is actually exposure to radiation, just in case anybody wants to know. I'm skipping table 10.3, 10 Tech 3. If I regret that later, I regret that later. Let's see. So we have two different types of leukemias. Generally, we have acute and we have chronic. And within those, we have two types as well. So for acute, we have ALL and AML. Don't quote me, but I believe that ALL is acute lymphoblastic leukemia. And then I believe that AML is acute myeloblastic leukemia. And I believe it's the same for chronic. So for chronic, you have CLL and CML. Chronic lymphoblastic leukemia and chronic myeloblastic. Something along those lines. Either way, it's not listed in our PowerPoint. So for the acute leukemias, you have a high proportion of immature non-functional cells in your bone marrow and your peripheral circulation. And the onset is going to be abrupt, and there's going to be a lot of marked signs of complications. Acute leukemias are also primarily in children and younger adults. And then we have chronic leukemias. This is where you're going to have a higher proportion of mature cells, which works because it's actually common in older adults. So you think older adults are more mature, kids are immature, so it kind of works. It has an insidious onset, and there are usually mild signs, and it's got a lot of a better prognosis. All right, so the usual signs at onset for acute leukemia, you're usually having frequent and uncontrolled infections, petechiae and purpura, and signs of anemia. You're going to have a severe and steady bone pain, which makes sense because it's in the bone marrow. Weight loss, fatigue, and possible fever, enlarged lymph nodes, spleen, and liver, headache, visual disturbances, drowsiness, and vomiting. So there's a lot going on there. I would definitely make a good note of severe and steady bone pain and your enlarged lymph nodes. That sounds like a pretty big deal. All right. So we've got some diagnostic tests for the leukemias. We have peripheral blood smears. So you're going to see a lot of immature leukocytes and altered numbers of white blood cells. Your number of red blood cells and platelets are going to be decreased, and you're going to need a bone marrow biopsy for confirmation. The primary treatment is going to be chemo. For the acute lymphoblastic leukemia in the young children, or ALL, that actually responds well to drugs. Good to know. Biological therapy or interferon. Remember, interferon does what? I know it's from Farm. Dig deep. Okay, so it stimulates the immune system. So biological therapy with interferon or an immune stimulant may be used to stimulate the immune system, so it might end up helping with leukemia. And then last but not least, but probably one of the more severe ones, is going to be if you need a bone marrow transplant. Complications. So you're going to have a lot of opportunistic infections with leukemia, including pneumonia, sepsis, congestive heart failure, hemorrhaging, liver and renal failure. They always fail. And then CNS depression and coma. So there's a lot of really severe complications with leukemia. I can't say necessarily one or the other. I would know most of those. All right, last slide for hemolytic alterations. Yay! Thromboembolic disorders. So a clot that attaches to the vessel wall is known as a thrombus, and a clot circulating within the bloodstream is known as an embolus. So these result in vessel occlusion and ischemia. So some of the things, if you think a little bit forward into cardiac, we've got 3 different disorders that we're going to see thromboembolic stuff going on with. We have our CVA, or our cerebrovascular accident or stroke. We have our myocardial infarction or heart attack, and we have DVT, which is also deep vein thrombosis. So keep that in mind. And what you're going to see with the thromboembolic disorders is this triad of Virchow or Virchow Triad. You're specifically going to see it in cardiac. I keep pointing behind me because that wall you see over there full of papers, that's cardiac. So when I'm going over cardiac, I'm going to move over there and show you guys what I did. But so for the Virchow Triad, you're going to have, if you have an injury to the epithelium of the vessel, if you have any abnormalities in blood flow, specifically when you're talking about DVT, you're going to see venous stasis, slow blood flow. And then last, you're going to have hypercoagulability of the blood. And that is it for hemolytic alterations, which I still can't say. And then my next video will be jumping into cardio. So hope to see you guys there.